You wanted to know how important well checks are for children that are like 5, 6 years of age and beyond. And most parents understand the importance of taking their children to the pediatrician for well exams when they're younger, like during the first few years of life. They're getting immunizations, they're checking to make sure they're meeting certain milestones, they're growing properly. And the pediatrician will continue to check for important growth and developmental milestones as your children get older. The things that the doctors look for as your child gets older are slightly different, but they're just as important. There are certain childhood illnesses, both emotional and physical, that doctors will check into as a child gets older. When children go to school, issues become attention span, their ability to read, write, focus, concentrate, to take care of themselves as they get a little bit older. There's questions about puberty. They want to talk to them about bullying and about keeping themselves safe, about how things are going on in the home, if they're doing well emotionally. So sometimes the doctor will want to talk to the child alone for a few minutes, and then also with the parents so that they can just get a feel for how things are going for that child. Of course, they'll also perform a physical assessment. They'll listen to your child's heart, lungs, feel their belly. They'll take their weight, their height, their vital signs. They'll check hearing and vision. All of those things are important to track as the child gets older too. If a child is either underweight or overweight, the pediatrician will take that opportunity to talk with the parents about what the child eats normally during the day, what their activity level is. It's an opportunity for parents to ask questions about things they might be concerned about, and for pediatricians to educate parents on what to expect. So it's not just for the children, it's also for the parents too. Especially if it's your first child, you don't know what to expect going into those years, and so it's a great opportunity to learn. In preparation for these appointments, write down any questions you might have about your child. If your children have been complaining frequently of certain things like headaches or aches and pains, write those down too so you can ask the pediatrician about it. Then, after they've asked you more specific questions and performed the exam, they'll decide if further investigation or treatment is necessary. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.